I'm grateful for your attendance tonight at our Zoom presentation of our prostate health educational talk. Tonight, we will be taking a topic which sounds like a question, but as you will soon learn tonight, it's a very, very important question we need to ask ourselves. So we will be asking you this question tonight and providing answers to the questions. Okay, so let's get on straight with the business of the day. All right, this is a nice little slide I have there. Protect your or his vital equipment. You cannot get a replacement. Okay, so let's get on straight to what we have today. Our organization is called Prosper in Health Association. Just like the name sounds, we help people to prosper in their health and also to prosper without compromising their health. It's an organization of entrepreneurs who believe in health and wellness, and we work cooperatively together here in Nigeria and all over the world from many countries where we participate together in events like this, and we do business helping people with their health. And tonight is just one of the many presentations we do on Zoom. We also do on WhatsApp. We also run live events. But since the onset of COVID, we've been doing mainly Zoom events. Tonight is on prostate health. We do several health topics, but tonight we'll be talking on prostate health. And just like our advert flyer says, the title of the talk is, When Should I Be Concerned About My Prostate? Tonight, we also welcome some special guests who will be joining us for the very first time. I forgot to introduce them. I'm sorry about that. This is actually the first time they'll be joining us. I'm talking about the community of the deaf. We have Mr. Toby, a wonderful professional sign language interpreter who will be interpreting for the deaf, who will be joining us from all over the world for the very first time at our events. So guys, you're all welcome for this first time you're joining us. I'm looking forward to having a lot more of you at our future events. Thank you very much, Toby, for helping us to interpret this message for the deaf. Thank you so much for that. So let's get on straight. Tonight, we're hosting this on Zoom, and it's powered by Prosper in Health Association. So let's get on to the business of the day. We're talking about when. So we have 10 points that we're going to share on that will let you know when you should be concerned about your prostate. Well, the very first one that will get you concerned about the prostate is when you realize you don't know anything about it. Oh yes, there's so many of our men who are totally ignorant about the prostate. Some don't even know that it is the name of an organ. I remember a friend of mine, I was with him in his office and I just asked him a casual question. Bros, what are you doing to take care of your prostate? Because it's about my age, middle age, closer to 60 than 50. You know how he answered me? Nice Christian brother, but very ignorant. He said, in Jesus' name, I don't have a prostate. I said, sir, you have prostate. I said, Boye, in Jesus' name, I don't have prostate. My dear ignorant friend thought prostate was the name of a disease. I said, brother, don't let me say amen to your prayers. You have prostate. You just don't have prostate disorder. So I had to educate him. That shows how ignorant many of our educated men are, and including even women. In fact, well, some are not even that ignorant. They just feel we're hyping it up. And they say to me, hey, Boye, what's the big deal? Like we say in Yoruba language, kini big deal. Why are you hyping it up? Oh, it's all about marketing. Oh, Boye, you're just trying to market people. What's the big deal about the prostate? See, guys, the big deal about the prostate is because you don't know it's a big deal. Even our women ignorantly say, like my friend said, hey, what's my own with prostate? Do I have prostate? I don't have a prostate. What is prostate got to do with us? Well, after all, women don't have prostate. That shows the high level of ignorance of people about this organ called the prostate. So the first reason why you should be concerned is when you realize that you don't know. You see, a lot of people don't know they don't know. Now today you will know, and you will get to know a lot more about this wonderful small organ. And why shouldn't you anyway? Not with all of the frightening statistics about it. Let me give you a few for you to chew on. Listen to well-known published statistics. Number one is that it is the second most commonly diagnosed cancer in the world after lung cancer. It is the number 5 killer of human beings all over the world. Let's drive it home to Nigeria. We're sorry, yes, I have people from Kenya, from UK, from US, but most of the audience is from Nigeria. So let's drive it home to Nigeria. Here in Nigeria, prostate cancer is the number 1 killer cancer of Nigerian men. In fact, it's causing so much concern because in those days, it was the older folks that have this challenge. Now, men in their 40s, early 50s are being diagnosed of stage 3, stage 4 cancer of the prostate. It is that bad. Well, statistics are hard to find and come by in our country here, but I lay my hand on this interesting statistic from the University College Hospital, Ibadan. Look at this statistic there, very frightening. The size of prostate is double all of them put together. Prostate cancer constitutes up to 40.67% of cancer sites in the bodies of men. That's really scary, don't you think? Now, such an organ that is so dangerous, in quotes, don't you think you need to know about it? Well, let me help you and clear some ignorance that is in the minds of people about this organ. So let me help you know about the prostate. That's a nice image there. It's tucked in one corner, very obscure little organ, just like the size of a walnut. Okay, so we just briefly, as a foundation to what we'll share later, to let you know the structure, the anatomy of the prostate gland. Now, it's an organ, but it's just not any type of organ. It's a type of organ called a gland. Now, what is a gland? A gland is any organ that manufactures and secretes its own fluid within the body or to the environment. So, the prostate produces a fluid and is found only in male animals. Female animals don't have it, including human beings. Okay, well, the next possible question is, okay, you say it produces fluid. What fluid does it produce? Good question. It produces a fluid called the prostate fluid. Some authorities call it the prostatic fluid. Well, whether prostate or prostatic, it's a fluid manufactured by the prostate gland. Actually, it's not actually one gland. It's about 30 to 50 glands, all of them producing fluid and putting all of it inside a common reservoir through ducts. So they just call it prostate gland, but the truth is that it's actually prostate glands. But hey, let's leave it the way it's called, prostate gland. Okay, so what's that fluid for? Well, it constitutes a third of the total volume of what we men release during sex, called semen. Semen, the liquid, that sticky, creamy liquid men discharge during sexual intercourse. The prostatic fluid make up a third of the total volume. The prostate also receives fluids from other neighboring glands. 2 neighboring glands at the top. It also collects fluid from the testicles, the seminal fluid. Then it mixes all of these fluids together and it pumps it out into a woman during the time of ejaculation. You can see how important that gland is. Okay, so it is needless to say that the prostate is very important for sex life and also for fertility, because at either sides of the prostate gland are 2 nerves. They're called the erectile nerves. These nerves send nervous impulses that release the flow of blood into the penis. Okay, so that tells you how important the prostate is for erection, penile erection. No wonder men that has gone through that terrible operation called prostatectomy, where they remove a part or the whole of the prostate, you find out that most of them cannot have erection again. They have permanent erectile dysfunction. That tells you how important the prostate is for sex. Okay, now the prostate, it surrounds a tube. You can see a cross section. There's a tube that passes through the bottom of the bladder, right through the center of the prostate, and comes out at the tip of the penis. You see, the bladder collects urine from the kidneys, but it drains it through one tube at the bottom, just like a reservoir tank has a pipe that releases water. That tube is called the urethra. Let's call it the urine tube. It's called the urethra. It passes right through the bottom of the bladder, through the center of the prostate, and comes out from the tip of the penis. Now, another tube comes from the testis. It's called the vas deferens. It comes from the testis, joins with the tube that it comes from the bladder. You can see the junction there. It joins it inside the prostate gland, and both of them drain out as one tube through the tip of the penis. You can see there, the prostate wraps itself around that urethral tube. You can see how God did that fantastic plumbing organ called the prostate. Okay, now because that same urine tube does a dual function to drain urine out of the body and to drain semen out of the body, God in his wisdom put some valves there. They are called sphincters. They are like some set of valves that control the flow of the two liquids, the two fluids, urine and semen, so that both of them don't flow together at the same time through the urethral tube. Can't you see how wise God is? Those sphincters, there are two sets of them. One is the internal sphincter, that's the one up, and one is the external sphincter. Two pairs of muscles, strong prostate muscles that regulate and control the flow of those two liquids. Now I've explained what the prostate is. Well, where is it? I did a seminar in New York years back. One man walked out. I asked publicly, let somebody that knows where the prostate is come and show us. This guy proudly came out to the front and touched his chest. That's where his own prostate is. A lot of men are ignorant. This is an engineer with shell. That is where the prostate is. You can see that artist's impression of the prostate there. Okay, but a more graphic explanation of its actual position can be gotten from the name. The word prostate in English actually comes from a Greek word called prostatis, which literally means one who stands before. If you look from the direction of the tip of the penis, the prostate stands before the bladder. If you are looking from the direction of the tip of the penis, it stands before the bladder. So it's between the bladder and the penis. That's how you know its exact position. And just to let you know where it is positioned, they call there's something they call the rectal examination of the prostate, where a trained finger will be put through your anus. You can actually touch the prostate. Why? Because it's very close to the rectum. It's called the physical examination. That's the only physical examination of the prostate. But please, it has to be a trained finger. A lot of men don't like that medical exam because it's quite awkward, seeing one finger being stuck up your you-know-where. You see that funny image there? Have a finger stuck up your you-know-where. So a lot of men feel very funny about that physical examination of the prostate. But just for the purpose of this discussion, it tells you exactly where it is, because you can actually touch it with a trained finger, gloved of course. Stick deep into your anus, you will actually feel the prostate gland. Okay, so the next question. Now you know about the prostate. Well, the next reason why you should get concerned is if you don't know the function of the prostate. That's the second point. I call it prostate purpose. what exactly is it for? I like the words of this great motivational speaker, Miles Monroe. He said, when purpose is not known, abuse will be inevitable. And that's exactly what is happening, because a lot of people don't know the purpose of the prostate. So they abuse it. And that's why we have a lot of problem with the male prostate gland in Nigeria, and indeed in many other countries today. So very quickly, let me give you the 4 key functions of the prostate gland. What exactly is it for? The first thing it is for, its most important function, is for reproduction. I told you earlier, the prostatic fluid is produced by the prostate. But I need to add one thing. Inside that prostatic fluid is an enzyme. It's called prostate-specific antigen, PSA. That enzyme is alkaline. That enzyme produces the food. It provides the food that your sperm cells will eat in their journey to fertilize the egg. So it provides nourishment. Then the prostatic fluid also provides an alkaline, I call it bulletproof, like a bulletproof vest. You see, because the urethra constantly releases, is a passageway for acid. Urine is acidic, we all know that one. So the urethra constantly releases acidic urine, and sperm cells cannot pass through an acidic medium. So PSA provides a kind of alkaline protection for sperm cells to pass when they are going out of your penis into a woman. But that is not even as serious as what happens inside the vagina of a woman. You see, God in his wisdom provided a very acidic medium for the outward part of a woman's vagina, simply because it is open to the environment and they are very susceptible to infection. So God used it as a kind of security measure, just like a guard, if you like. So the outward part of the woman's vagina is very acidic, and an acidic medium is not good for sperm cells. It will just kill all the sperms. PSA provides the alkaline protection for sperm cells to swim through that danger zone, I call it, so that they can go and do the job that they are supposed to do, fertilize the egg. Can you see how important the prostate is? Then it controls sexual health to a large extent. I told you the erectile nerves help with erection, but more importantly, the prostate contracts rapidly and powerfully to release semen. It will contract violently and push out semen out of the penis deep into a vagina. And as we all men know, ejaculation is the peak of sexual satisfaction. When a man doesn't ejaculate powerfully, he doesn't really enjoy sex. And when the man's prostate is weak, he cannot pump out the semen with enough power to go deep into a vagina, and you find out that in some women, the semen leaks out. In the part of Nigeria I come from, the Yoruba, we have this myth called EDA, E-D-A. It's a foolish Yoruba myth, excuse my language, where they say that a woman that when the husband has sex with her and she stands up and the semen leaks out, she has a spiritual problem, that she has a spiritual husband who gets jealous every time the husband, the physical husband, sleeps with her, and now scoops out the semen, don't ask me how, scoops it out of her vagina after sex. Oh, that is so foolish. There's nothing spiritual about it. It is the man's prostate that is not strong enough to shoot the semen deep into the woman's vagina. Like I jokingly say in my seminars, people that shoot from box 18, they have not scored goal. You want to shoot from semicircle, you can't score from semicircle, ladies and gentlemen. The prostate must be strong to push the semen deep into the vagina. And that's why the prostate is good for sex. Okay? The third reason why the prostate is made for is to be able to control the flows of semen and urine. I told you both of them pass through the urethra. So when semen wants to pass, urine must not pass, and vice versa. So the job of the prostate is first to regulate and then to control. Let me explain the two. Regulate means it will decide which fluid will pass. Is it semen or is it urine? Then control means that if it is allowing urine to pass, it will determine when urine will start and it will determine when urine will stop. If it is allowing semen to pass, it will decide when semen will start to flow and when semen will stop to flow. That's what I mean by regulate and control the flows of semen and urine. Now, when you understand this function, you will understand the reason why people have premature ejaculation. Is that function of those sphincters that is not regulating and controlling the flow of urine and semen. We'll come to that later when we talk about the symptoms. But I want you to understand this function because this is very fundamental in all the things that I'm going to share with you tonight. Lastly, well, the prostate does the job of environmental sanitation, as we call it in Nigeria. It helps to clean out not just the prostate, but the entire urinary system. It sounds like a sieve that helps to clean the whole system, all in the bid to protect sperm cells from contamination. Okay, so the prostate serves as a sieve. And you know, ironically, this is one of the real problems of the prostate because it does the job of cleaning too much that it breaks down. Why? Because we just won't stop taking toxin. So the prostate is over-labored with the job of cleaning the system. And very soon, it packs up. That's why we need to watch what we eat. We'll come to that shortly. Okay? So these are the 4 major functions of the male prostate gland. The third reason when you should be concerned about your prostate, when you are near 40 or you have attained the age of 40. If you're listening to me this evening, you are not yet 40 years old, and you are sure you will die before 40, I think this is not for you. But if you are sure that you will get to 40 and beyond, or maybe you are listening to me and you are over 40, I am talking to you because something happens in the bodies of men when they hit 40. 40 is a landmark age, and I'll come to that shortly. And you know, 40 is your age in years. They call it the chronological age. But there's another more important age, your biological age. That is the age of your internal organs. Some people may be 50 chronologically, but their organs are 80 years old. They have aged faster than their age. That's why I put it there. The body ages as you age. For some, the body ages faster than their age. That's why men in Nigeria, even in their 30s, are having prostate disorders. Medical science tells us that something happens in your body when you get to 40. All of these parts of your body start breaking down. It is science, I'm telling you. The lungs don't perform as before. The kidneys don't perform as before. Your sexual strength is not as good as before. Your fertility wanes. Your bones are creaking. You cannot be as strong as you were before. Something happens to human beings when they reach 40. The body breaks down slowly. There's a price to pay for growing old, folks. Ladies and gentlemen, no wonder the psalmist, knowing that something happens when you age, prayed a very powerful prayer. And I believe even Muslims should pray this prayer. The prayer is in Psalm 90 verse 12. He says, teach us to number our days, to realize we are growing old. Why? So that we can apply our hearts to wisdom. You see, if you are over 40, 50, and you are still drinking tea with 4 cubes of sugar, you need to go and, like we say in Nigeria, borrow some sense. This guy is praying this prayer to God, teach us so that we realize we are growing old and borrow us some sense, like we say in Nigerian pidgin English. Sorry if you don't understand our Nigerian lingo, you get used to us in Nigeria, okay? This is a graph that shows what happens to men as they age. The incidence of prostate disorders increase as you age. And you can see that graph. From 40, the incidence of prostate disorder seem to be more when a man nears or reaches 40. This is science, I'm telling you. So once you get to 40, science have found out that something happens in your body. 40, ladies and gentlemen, is the landmark age. And that's the age that we need to take more caution on our prostate health. Why? I take it on the next point, the fourth point. When should you be more concerned about your prostate? When you knock 40. Why? Because something happens in your body. The main hormone that is responsible for a man's sexual behavior, among so many other things, is called testosterone, drops sharply when you get to 40. Another hormone, which is more common in women, but we men produce it too, is called estrogen, rises sharply from that age. Scientists have found out that that phase of hormonal imbalance takes place when a man nears or attains the age of 40. It is known by the medical word andropause, the male equivalent of the female's menopause. This comes to a surprise to so many men. Say, what do you mean, Boye? You mean we too go through menopause like women? Yes, we do. Theirs is called menopause, ours is called andropause. Now look at this graph here. Very interesting graph. The dark brown represents testosterone. Look at it in teenagers, full tank. In your 20s, in your 30s, see what is happening by 40. By 50, 60, 70, 80 and above, no more testosterone in the body. So what happens to testosterone? Well, actually, testosterone doesn't just disappear. Testosterone gets converted into another hormone. It's a chemical reaction by an enzyme called 5-alpha reductase, but this is not relevant for now. Just know that testosterone gets converted to another hormone called dihydrotestosterone. Don't bother about that name. Just call it DHT. It gets converted to DHT. I call DHT area boys hormone. Scientists call it unfriendly hormone. Unfriendly in quotes. But I call it area boys. Now for my audiences that are from foreign countries, especially those from other African countries, I have guests from Kenya, from Ghana, from South Africa on board here. Let me explain what we mean by area boys. In Nigeria, these are local miscreants, unruly guys that just cause confusion. Okay? So I call it area boys hormone. Do you know why? Because DHT is actually what is responsible for instigating a riot, in quotes, in the prostate cells. They cause a riot in the cells of the prostate, that riot causes those cells to start multiplying rapidly. The process is called hyperplasma, but leave all of that. It starts producing rapidly, and that rapid production of more prostate cells leads to an increase in the overall size of the prostate. So it's not that, testosterone just vanishes into thin air. No, it gets converted to DHT, and DHT is the one that causes the cells to start reproducing rather rapidly, and leads to the expansion of the organ. That is why you need to be careful when you get to 40. Number 5 points. When should I be concerned about my prostate? When that enlargement process begins. Ladies and gentlemen, whether you know it or not, whether you agree with me or not, your prostate is enlarging as you are listening to me. Now, what happens when the prostate enlarges? I want to show you that cross section again. You can see the bladder. You see that tube that passes right through the prostate. That's the normal prostate gland. Looks normal, right? Now, what happens when it starts enlarging? You can see the arrow there. Urine is flowing freely through it, right? Now we'll see what happens when it starts enlarging. It starts squeezing that tube that runs through its center. If you put your finger inside your fist of your other hand and squeeze it with your fist, you understand what happens to that tube that is draining urine. It squeezes that tube. And when the process of enlargement continues unabated, can you see what has happened to that tube? It has squeezed the living daylight out of that tube. This is the process, ladies and gentlemen, of enlargement of the prostate gland. This is why you should be concerned about your prostate. You say in Jesus' name it won't happen. I will help you say amen. But it doesn't stop it from happening. It happens in all men of all races, in all countries, all over the world. The prostate enlarges unless you do something about your own. That's right. I jokingly put it there. Prostate enlargement, problem enlargement is a question. Only you can provide the answer to that question. Another thing that happens with age is that the cells of the prostate get contaminated. I'll just use that word loosely. What causes the contamination? It's called free radicals. Let me do a little bit of biology here. In every cell is an atom. Inside every atom are electrons. Those electrons have positive and negative. They are paired. But unfortunately, some atoms are not paired. They are called unpaired electrons. So what happens to them is that they go and attack other atoms to go and steal their electron so that they can be paired. And when they steal an electron, it renders that one that they have stolen electron from to be bad too. Any electron, any atom that doesn't have pair, positive and negative, is called a free radical. And once you have a free radical, it goes to steal electron of another atom, thereby turning that one into a free radical. That one too will go and steal, and the domino effect of electron stealing continues until they destroy that organ. What is the antidote? They are called antioxidants. What does antioxidant do? Remember, the problem is that there is electron shortage. Well, antioxidants will come with their own electron and, like a savior, donate their own electron and die. Shebi, the problem you have is electron shortage, Abi. Oh yeah, take my own electron. So antioxidants come to neutralize the damaging effects of free radicals. And as you age, especially as you reach 50, you have a lot of free radical damage taking place in your body, especially if you live in environments like the South in Nigeria, where there's a lot of gas flaring, a lot of toxic environment, especially when you take foods that are chemicalized, especially when you live in environments where there's a lot of radiation, especially if you do a lot of physical exercise, because the body also produces free radicals through strenuous work. All of this produces free radicals. You can see that's a free radical there, unpaired electron. Well, what happens is that you now need antioxidants to neutralize it. Okay? That's why you need to take antioxidants. Very, very important, especially when you have reached 50. Then the second thing that causes damage is when the cells are malnourished. You see, it's not just food to fill the stomach, but food to feed the cells. This is called cellular nutrition. Listen to a 2-time Nobel Prize winner. Linus Pauling says, in quotes, nearly all diseases can be traced to what? Nutritional deficiency. Okay? Look at this irony. People are overfed, but they are also starving to death. Why? They are overfed with junk food that don't have nutritional value. And once the cells don't have nutritional value, they cannot do the necessary wear and tear repair, and they pack up. And that's what exactly happens in the prostate. So those two things, free radical damage and cellular malnutrition, also happens with aging. Okay? So we've covered that area to be able to show you the foundation. The next point, point number 6. When should I be concerned about my prostate? Ladies and gentlemen, when the prostate disorders show up. If you're listening to me tonight, because I know many of you are already experiencing one challenge or the other with your prostate, if there's a problem down there, you better listen and listen good. You need to be concerned. Why? As I'll soon show you, these challenges of the prostate start slowly, often without notice, but they have one common feature. They rapidly deteriorate. Rapidly. Within 1.5 years, 2 years, bam! It has caused a big problem. So, if and when you've been diagnosed with prostate disorder or prostate cancer, you need to be concerned about prostate. Now, that is why I explained first what can trigger prostate problem. I use the word trigger. Do you know why? Because medical science has still not yet adduced a causative factor. However, these points that I shared just now are the triggers of prostate disorder. Let's just run a summary. Aging of man. I'm not saying age, I'm saying aging. There's a difference. Hormonal imbalance. The drop in testosterone. Or did I say drop? I've taught you better. The conversion of testosterone to DHT. The third one, cellular damage or cellular malnutrition, or both. These are the triggers of prostate disorders. And you need to take care. Preventive if you are not experiencing challenge. Restorative if you are already challenged. That is the 6th reason when you should be concerned about your prostate. As a follow-up to that, the next point, the 7th reason, the disorders of the prostate. We're going into the deep end now. Let's go through the disorders of the prostate very quickly. There are 3 main types of prostate disorders. The first one is called prostatitis. It's an infection of the prostate that causes an inflammation. Inflammation is just something swelling in size, just, getting swollen. The second one is called BPH. It's a very jaw-breaking name. It's called benign prostatic hyperplasia. What does that mean? Let me break it down. Benign means non-cancerous. Hyperplasia means rapid multiplication of cells. So let's bring it together. A non-cancerous rapid multiplication of the cells of the prostate gland. That explains it, right? And the third one, the cancer of the prostate. And what is the cause of that? Multiplication of abnormal prostate cells. That's the third one. That's the one that is dreaded the most. All right, so let's briefly look at them, very briefly, at these 3 main types. The first one, prostatitis. I told you it's a swelling or an inflammation of the prostate. It's caused by a bacterial infection usually, but there are other causes known by science. But usually a bacterial infection, either within the bloodstream that comes to affect the prostate gland. Some people have bacterial infection of the gallbladder that comes through the bloodstream. It's just a bacterial infection. Well, usually it comes through sex, STDs. Out of every 10 cases, you have about 6, 7 that got it through sexually transmitted disease. Usually it comes through that. And it happens in younger men, from about 25 to about 40. Okay, so a usual causative factor is sexually transmitted disease. Well, the second one happens in we older men from 50 and above, the BPH. That is a non-cancerous, remember I told you, non-cancerous. So don't let your heart be troubled when they tell you you have prostate enlargement. That's the one popularly called prostate enlargement. You know, a lot of men get very scared when they tell them their prostate is enlarged, and don't start writing your will yet. Don't start writing your will yet. Okay? You are not going to die. Okay? In Jesus' name, you won't die. But what I'm just saying is that it is non-cancerous. Okay? Don't think you have prostate cancer because they say you have prostate enlargement. Okay? It's just a swelling of the prostate caused by the rapid multiplication of the cells. And these days, we have young men under 40 that are already troubled with their prostate and they have BPH. Okay? The third one, people don't like me talking about it, but I still have to talk about it. The cancer of the prostate, like I said at the beginning, is killing Nigerian men more than any other cancer. May God protect even young men these days. Okay. The eighth reason why you should be concerned with your prostate is when you start seeing signs and symptoms. And the thing about these symptoms is that most men don't even know it's their prostate that is malfunctioning. They just think it's normal. Some even explain it away. You know, they rationalize it. Some even play dead and pretend as if nothing is wrong. Some are totally ignorant. So today we want to clear all of that doubt and let you know when. This point is very, very important. Please listen attentively because I'm going to go into details here. Take down notes and listen if any of what I'm saying resonates with you or with your spouse. I call them the red flags. Now, I group them into two. Remember, please, this is not medical grouping. This is just Boye classification of prostate symptoms, okay? I call the first group bedroom symptoms. I call the second group, the first group bathroom symptoms, beg your pardon, and the second one, bedroom symptoms. I think my images say a lot more than my words, okay? So you can see the two. So let's have a look at it. And we will take a chronological review of it. What do I mean by that? We will start with the simplest of the symptoms. And I will take you step by step through the degeneration and the deterioration. Remember, all it starts with is with the enlargement of the prostate as it squeezes that tube. That's why I had to explain the anatomy of the prostate to you so that you will understand as we explain it now. Let's start with the bathroom challenges of the prostate. Let's look at urinary challenges that are symptomatic to prostate disorders. That's big English. Let's call it pissing problems of the prostate. Piss. In Nigeria, we call it piss. Urination. Pissing problems. Let's look at it one by one. They fall under groups. The first group we're going to look at are the ones they call voiding problems. What does that word voiding? What does it mean? Voiding means the expelling of urine, the process of expulsion of urine from the body. Urination, okay? So we start with the very simplest of them all. Reduced pressure flows of urine. Every man experiences this as you age. It's just that you don't take cognizance of it. As you go to urinate in the toilet, don't you notice that you can't aim the toilet seat as you used to before? Don't you notice that the toilet seat gets stained? Even the floor? As the pressure reduces? Look at from number 1 to number 2 to 3 to 4 to 5. Can you see the diagram of number 6? No, he's urinating on his clothes already. Look at your young 10-year-old child. If he urinates, he can even spray you 10 meters away. The prostate is strong. But if daddy urinates on the toilet, the whole toilet is stained. When I go and use public toilets, I look at the whole floor full of urine. I understand. Men are challenged with their prostate. I was eavesdropping on 2 ladies talking. One of them, they just had a party in their house. She was telling her friend, I will never allow my husband to host his friends in our house again. Lie, lie. If you see how they just messed my toilet, come and see urine everywhere. I just smiled. If only you know what is happening to your husband and his friends. I just smiled. If only you know that they are already experiencing what is called BOO, bladder outlet obstruction. Reduce urine pressure. Then it becomes dribbling. When you finish urinating, the normal thing for women to do is to ring the bell. I'm sure all men would know what I'm talking about when I say ring the bell. But the problem is that some men ring the bell stronger and longer than others. Yet, it still drips. Ladies, check the underwear of your husband. Is it damp? Is it smelling stale urine? Don't just throw it to the laundry basket. Feel it. Is it wet? Maybe he's dribbling. Then they call the other one residual urine volume. Long after you leave the toilet, one large volume of urine comes out. Boom! You can imagine going for a management meeting. During the meeting, you go and use the toilet. You come back, and during the meeting, boom! You look at your trouser, there's a map of your village on the couch. That is what is happening. Dribbling. Oh, how about urgency? When you cannot hold urine, you just have to pee now. I know a man, he has a bottle of Ever water, plastic bottle of this bottled water, tucked under his driver's seat. Do you know why? Because when he's in traffic, he cannot hold back the urine. He will bring out his penis and urinate inside that bottle because he cannot hold. He didn't know it was his prostate malfunctioning until I told him. Say, sir, this is not normal. You know, we public speakers, we have to hold urine for a long time. Our prostate has to be strong. Imagine if I have to take a break to go and urinate. Wouldn't you think this guy has a problem? Okay, so that's the first set of challenges. Well, let's look at the worst one. Remember, I told you we're doing it chronologically. It gets worse. Delays to start. You go to the toilet, you want to urinate, you are groaning because the urine is not coming out. When it eventually comes out, it comes in trickles. Ladies and gentlemen, it gets worse. I don't mean to scare you, but it gets worse because it starts getting peppery. You have this burning sensation. And you know, for a lot of promiscuous men that have unprotected sex, they think they have caught gonorrhea from their girlfriend. They don't know it's their prostate that has been infected by the bacteria that is causing tingling sensation. And for some men, if you look at that extreme right diagram, image, excruciating pain. They cannot urinate unless with a lot of strain. We haven't even started. Fasten your seatbelts. Let's go into more voiding problems. Nighttime urination. Do you wake up 3, 4, 5 or more times before day breaks to go and pee? Oh, this is where some men explain it away. Oh, you know, Boye, I drink a lot of water at night. Hey, guy, you're waking up 2, 3, 4, 5 times to go and pee before daybreak. You are experiencing nocturia. That's the medical name. Go and Google it yourself. Don't wish it away. Don't explain a problem away. Realize you have a challenge and let's help you resolve it. Frequent nighttime urination. Oh, we enter the second group of bathroom problems. Urinary incontinence. Remember, you started first with dribbling. Yeah, the tap doesn't just close. Remember when your kitchen tap is faulty? It doesn't close, it just drips. Then what happens? Urine leaks. Little drops. If your kitchen tap, your bathroom tap is leaking, you think those drops will not amount to much. Put a bucket there. Check it out the next day morning. Urine leaks. The urine leaks get more serious Before you get to the toilet, you've wet your trouser. Urinary incontinence, you are gradually losing control of urination. You start using diapers, ladies and gentlemen. Oh, I was in Ibadan at a ShopRite, a shopping mall. They put a banner in the front door of that supermarket, or just by the front door. Adult diapers available here. They don't hide it anymore. Go and check your neighborhood supermarket. They sell it there. Adult diapers. That's what is happening now, folks. Because men have totally lost control of urination. Adult diapers sell more than children's diapers these days. It's hot cake here in Lagos. All over Nigeria, sir. Listen to what I wrote there. Diapers are meant for babies, in case you don't know. The next group of problems of the bathroom is when the infection sets in. Lower back pain. Some, you can't even get up in the morning. Excruciating pain. It's called CPPS, chronic pelvic pain syndrome. It gets worse. It becomes the acute pelvic pain syndrome. Pain around the groin. Pain around the testes. Pain around the scrotum. Is this you? Let's talk. If it's you, it gets worse, ladies and gentlemen. Remember I told you the prostate continues to squeeze on that tube? It continues to squeeze, the stranglehold, like a vice, squeezing the living daylight out of the urethra. Very soon, urine that has to pass through the urethra out of the penis is retained inside the bladder. So, you have this full feeling even after you leave the toilet. Why? Because there's still urine in your bladder. Yes, you went to the toilet, but you still feel like going to the toilet. Why? Because your bladder is still full. The bladder that is supposed to take about 35 cl worth of urine, normal Coca-Cola bottle, is now being forced to hold 1.5 liters of urine. The bladder muscles get expanded and they can't hold anymore. Incomplete emptying is what they call it. Ladies and gentlemen, it gets worse. Look at this diagram of the penis. The one on the left, look at that green arrow. Urine is going out, right? But look at the one on the right. The one on the left, the urine can flow well. That green arrow. Take a snapshot if you like. Look at the one on the right. The urine is retained. Urine retention. Urine now stays inside the bladder longer than is necessary. And as you know, urine is acidic. And any environment where there's a lot of acid is conducive for bacterial growth. So bacteria start growing freely inside the bladder. And of course, because the kidneys are connected to the bladder, bacteria infects the kidneys too. A lot of people are wondering, but the problem that you have is prostate. How come is kidney problem again? Yeah, they're related. Yes, they're related. Acute urine retention takes place. Urine stays in the bladder. Why? Because there's no way for it to come out, is there? Because you did not do anything before. Because you thought Boye is just a marketer trying to sell to you. Worst case scenario, alarming bathroom challenges. Am I trying to scare you? Not really, but you better be scared. Because this, ladies and gentlemen, is the worst case scenario. Bladder and kidney infection takes place, bam. Very soon, the urine that gets retained inside the bladder start forming stones. Why? Because they are minerals that are supposed to have been exited from your body. But because they're still there, they form crystals. Tiny, tiny things like pebbles. Those crystals start abrasing the wall of the bladder. It starts scratching the wall like sandpaper. Very soon, the bladder starts bleeding. What happens? You get bladder and kidney stones. You start having blood inside your semen. It's called hematospermia. I call it bloody semen or bloody urine. Why? Because the urine that is supposed to have left your body have now formed stones, and the stones are wounding the walls of the bladder. They've also affected your kidney. You now have kidney stones that migrated from your bladder to your kidney. You're still sitting down there. The stones block the outlets. Bah! Like they say in sports, game over. You suddenly wake up to go and pee, like I've heard that story many times over. Suddenly wake up, get to the toilet, you want to pee, urine is not coming out anymore. They rush to the hospital, they have to pass a scientific apparatus right through the tip of the penis to drain urine from the bladder. It's called catheter. You don't need to get to all of this. Let's go to the bedroom. Sexual health disorders of the prostate. Like I said there, if matters of the other room matter to you, you better let us discuss the matter. They know they take and shame more. Sorry, I'm speaking pidgin English. For those that are not Nigerians, I'm sorry. You don't have to be ashamed. The first problem is that of andropause. Remember I told you, testosterone is the main sex hormone. It's what is responsible for the overall sexual health of a man. So what happens at andropause, when a man nears or attains 40, it drops, like I told you, and of course you see the effect in the bedroom. The man is missing in action in the bedroom. It shows first in that, the male menopause, like some doctors jokingly call it, man-o-pause. Indeed, there's a pause. You know what I mean? See what I wrote under there? The rise and fall of a man. Andropause. Look at this diagram. Very nice image of a horse and a rider. Somebody said, but Mr. Boye, this is not a horse. I think you need to go for deliverance. Because me, I can see horse here. If you're not seeing horse, I think we need to cast out some spirits out of you. Because this is a horse. Or isn't it a horse? It's just that over time, the rider is having problem with the horse. Why? Because the horse gradually goes out of action. The riders are getting frustrated. Just look at the wicked look in that woman's eyes. Low libido. The man is just not in the mood. He is just not in the mood. And if and when he gets in the mood, he doesn't last. She's just there high and dry. A lot of women don't understand this. They think that maybe he has another lady outside that he is spending more time with. Hey, please listen to me, ladies. Don't have my head. I'm not trying to exonerate your husband of his philandry. No. But what I'm saying is, have it crossed your mind that he may be going through andropause? Just an option. Because your bedroom has now become a cold room. Ladies and gentlemen, to be horny is very healthy. If you are not horny, you have a problem. There's so many couples that they have not had sex together in months. Did I say months? Years. And it's not that they are fighting. It's just that daddy has gone off. If you know what I mean. Yet these are other signs of andropause, low testosterone. It goes by the medical word. I don't like speaking high-sounding medical words, but you need to just hear it. Hypogonadism is the name, low testosterone. But don't bother about the tongue-tying medical name. Just call it by its popular name, low T. Low T. These are some of the signs of low T. You can take a snapshot of it. Okay? That's it there. But let me show you some unusual signs of low T. You have longer refractory periods. What does that mean? Interval between orgasm. Some men cannot remember the last time they slept with their wives, and they don't even know it. Reduction in testicle size. The testes just shrink. Reduction in semen volume. Remember I told you the prostate is there for semen production? Reduced body muscle mass is just shrinking. Mood swings and depression. Even suicidal tendencies. That's right, testosterone affects a man's emotions. Then the funniest one of all is this last one. A lot of men open their mouth wide when I tell them this is one of the best images that I saw online for this training. No, it's not a woman, it's a man. That's right, a man. Oversized breasts. It's called gynecomastia. When the hormones that are more for a woman is now showing more in the body of a man. Estrogen. A man is developing feminine features. Estrogen is more in women than men. But what happens is that his testosterone drops, but his estrogen starts shooting up to an alarming level. And he starts growing breasts like women. I was with a friend. He was putting on a nice t-shirt, tight fitting, you know, very light texture t-shirt. And he's quite muscular, you know. And I just looked at the position of his nipples. I don't know why my eye, you know, when you know these things, your eyes just look where you're not supposed to look. I looked at where his nipples were. The nipples were on his stomach. And I said to myself, oh my God, how will I tell this guy that he's having gynecomastia, that he's going through some unusual low T symptoms? You haven't seen anything. See the next one. More unusual low T symptoms. This one really beats me flat. Low T is also responsible for the size of a man's penis. When the penis is small or is shrinking in size, it's a function of low level of testosterone. I did a seminar in Sheraton some years back, about 2 years ago, and I put up this slide there. Does size really matter? You know what? I just decided to ask my audience, and all the women just shouted, yes! All the men in the hall, well, they were very embarrassed. And I decided to be a little bit more mischievous. I said, can somebody change the caption of this image? Can you give me a better caption instead of, does size really matter? Guess what one cheeky lady said? She stood up and said, a better caption is, and you call yourself the head of the house. Oh my God. Oh my God, were the men in the room there embarrassed? In fact, I was embarrassed on behalf of all the men. I know the women were just laughing. He said, that's a better caption. And you call yourself the head of the home. Oh God Almighty. What an embarrassing problem. Well, compare that to the man that showed off his Hummer Jeep. Look at the expressions on the faces of the two women. Size really does matter. Oh, the next one is quite embarrassing. The 2-minute noodle man is faster than Usain Bolt in bed. He's down even before the beginning of the match. The woman says, I'm ready to start. The man says, game over. It's called premature ejaculation, PE, in medical jargon. If you're experiencing that, we can help you. Well, Another one is painful experience during ejaculation. Remember again, infection has set in, the pipe, the tube that drains semen is squeezed. So when a man wants to ejaculate and is having problem and he screams, ladies, is not likely to be out of pleasure. I jokingly tell women, listen carefully to that scream when he reaches orgasm. It may not be out of pleasure. Very embarrassing, isn't it? Painful ejaculation before, during, or after the thing is released. That's another serious problem. I hope you're not too scared, but this is just the truth. Our women are the ones that are taking the brunt of all of these things. They're the ones going through all the hell. Our problems are the ones giving them problems. The woman is just asking, why is this man like this? What is happening to my man? He used to be a super stud before. What has become of my man? She just doesn't understand. And she begins to accuse him of extramarital affairs. That must be the only reason the home gets heated up. Especially if more problems set in caused by the prostate, infertility. Remember I told you the prostate is responsible to a large extent for a man's level of fertility. And making babies for men who have trouble with their prostate is no child's play. Male infertility, ladies and gentlemen, is on the increase now. A lot of men are challenged in this area. And you know, people just talk, oh, sperm count, sperm count. There's a lot more. How about semen health? How about sperm motility? How about morphology? Sperm count is the number of sperm per ejaculate. But how about the motility, their movements? How about their size and shape? All of these are very, very important, and the prostate helps in this area, okay, in the spermatogenesis process. Why? Because testosterone is very important for sperm production. Well, we've been talking about the problem all evening. Is there a way out, Mr. Boye? Yes, of course there's a way out. That's why we're here. But you see, if you do not know the problem, you cannot understand the solution. So, what's the way out? You may be wondering. We have a solution in three main dimensions. The first one is preventive if you're not experiencing any challenge yet and you don't want to wait. Now you see what will happen. You know, because some people listen to me and say, oh, that's a nice presentation. Oh, thank you. That was a good one. I gained a lot. Hey, I'm not here for an academic exercise. I'm not a lecturer. If you listen to all what I've shared today and you just believe and say, wow, good information. You don't need information. You need to act on information. You say knowledge is power. No, sir. It is application of knowledge that is power. The second solution is your diet and nutritional counseling and management that will give to you. And the third approach, hey, help us to reach more people and make money out of it. Wellness. We'll show you how to do it digitally. You're not going to hack anything around. It's digital marketing, digital wellness business. We'll show you how you can leverage on platforms you use every day, but you don't know that people make millions. I'm talking about social media platforms. That's another training altogether. But get in touch with our partners. I'm just here to represent a group of people locally and internationally. All my partners invited guests here today. I also invited. It's just that I'm their servant. I'm the one to do the talk. But as soon as this presentation is over, get back to the person who invited you. Now, you may know the person by name, yeah? But for most of us, we invited strangers, people that we have not yet met. So if you're listening to this and you received a message on Facebook or WhatsApp or wherever, I'm sure there's a name and a phone number connected to that advert you saw for this event. Please get back to that person. Wherever you are in the world, I have people from different countries who are my partners, and we work cooperatively together to run these events. So please get back to them so that we take it up from here. Okay, the first approach is, of course, preventive. They say prevention is better than cure, but it's a lot more than that. Prevention is not just better, it's cheaper and safer than cure. I like this quotation so much. I got it online. Health is not valued until sickness comes. A lot of people don't value good health. It's until you lose it. But why wait till you lose it? Why don't you protect good health? Do you want to wait until you start urinating blood? Do you want to wait until your penis is not working again? Is that when you want help? Or when you can't sleep at night again? Is that when you need help? The first way I recommend is go and get checked. Go for a PSA test, prostate test. But I need to sound a note of caution on PSA test. Do you know why? Because PSA test does not really give an accurate measurement or accurate result of this exact state of your prostate. Shall I tell you why? Let me give an analogy. You understand me well with this analogy. Imagine a jerry can filled with petrol kept inside your store. You come back the next day and you see the jerry can 1/4 full. It was a full jerry can before, and you see petrol all over the floor. What does that tell you? It tells you that the keg is leaking, right? But it does not tell you whether or not the keg has expanded in size. It doesn't tell you that. It just tells you that it is leaking petrol. Now, let me explain. Inside the prostate, I told you that there is prostate fluid. I told you prostate fluid is the main ingredient in semen. I also told you that inside prostate fluid is PSA, which is an enzyme that produces nourishment for sperm. PSA. Now, PSA ordinarily should stay inside the prostate. But as we grow old, the PSA leaks into the bloodstream. Now, it's okay because they have a chart that they use to measure the acceptable concentration of PSA that has leaked into the blood. So once it reaches or it goes beyond that accepted level, it is said that the prostate is defective. That means that your prostate has leaked PSA more than is acceptable. But ladies and gentlemen, the fact that your PSA is high doesn't tell you anything about the size of the prostate. It just tells you that the prostate is leaking. It does not tell you whether or not it has enlarged and by how much it has enlarged. Just like that jerry can only tell you that petrol leaked. It cannot tell you whether the keg has grown bigger in size. That is the only problem with PSA tests. I had an elderly man, I use his example so much. An elderly man that listened to me teach on prostate. This man is in his 70s, and he told me, look, all of what you said exactly was what was happening to him, but they were telling him it was diabetes. He said he had spent about 300,000 and he was treating his diabetes. But all of what I said was what he was going through. What is the problem? He sent his PSA result. This man had PSA result of a 35, 40-year-old. When I showed him, I referred him to, when he showed me, I referred him to a neurologist. This man's bladder was almost bursting. They drained out over 2 liters of urine from his bladder. Yet, they were telling him that his frequent urination was because of his high sugar level. He was treating diabetes, whereas his bladder was full, whereas his PSA reading was perfect, yet the prostate was enlarged. So PSA can only tell you how leaky, in quotes, your prostate is. It cannot tell you by how much is at enlarged, if it has enlarged at all. So how do you know the state of enlargement? Well, they call it the prostate scan. They do an MRI scan of the pelvic region, which shows exactly the size of the prostate, whether it has enlarged or not. But the simplest one is the physical examination, the one we call the renal examination of the prostate, where they stick the finger up the anus. You remember I taught that one earlier, yeah? This image, yeah? That's the first one. They can actually feel it. A trained finger, when it touches that prostate, it knows if it has enlarged, okay? So that is that. The second way is you can do what they call Kegel exercises. Go on YouTube, you'll see a lot of videos on Kegel exercises that strengthen the prostate muscles, okay? You can watch that on video on YouTube. A lot of YouTube videos are on that. The next approach in preventive health is compulsory changes in your diet. The key word there is compulsory. I like this quotation. If you don't eat your food as medicine, you will end up eating your medicine as food. Like my dear friend there. Can you see thermometer is a spoon? You better eat your food as medicine so that you don't end up eating your medicine as your food. Okay? Watch out what you take as you grow old. So what foods are good for the prostate? The best ones are fruits and vegetables. They have anti-cancer agents in them. It helps to protect your prostate. Take a lot of it. A friend of mine just reminded me just a few days ago that it's me that teach them at my training that wives should collect food money and fruit money separately. After collecting food money for the month from your husband, please collect another money called fruit money to make sure he eats fruits and vegetables. Wives, is in your hands. The prostate of your husband is in your hands. Out of all the fruits and vegetables, this is the best one. Oh my God, I can spend 2 hours teaching on broccoli. Broccoli is known as a, in quotes, superfood for the prostate. And you know how to take broccoli? Don't cook it for too long. Boil water, just dip it inside water just to kill bacteria. 3 to 5 minutes max, and chop it and eat it raw. Oh, broccoli is fantastic for the prostate. Is a member of the family of vegetables called the cruciferous vegetables. In that family, they have other cousins like cauliflower, like kale, like spinach. These are the cousins, but out of all of them, this is the best, okay? It helps to break down estrogen. Remember I told you estrogen rises sharply. Well, this broccoli and some other members of the cruciferous family break down estrogen that rises to uncomfortable level when a man reaches andropause. The second one is tomatoes. That's right, tomatoes. Tomatoes contain a very important antioxidant called lycopene. Lycopene is stuck inside the cell wall of tomatoes. So taking tomatoes raw will not give you the best of lycopene. Why? Because your body cannot grab the lycopene well, because it adhered fastly on the cell wall. So for you to get the best of lycopene, you need to process the tomatoes a bit. How do you process it? Steam it, juice it, fry it, light frying. Let them cut a lot of it. When they cook me eggs, it's only tomatoes you see in my eggs. And it's light frying. When the egg is almost done, that's when they put the tomatoes there. So you take it fresh, just the heat, just to open up the pores so that your body can withdraw the lycopene from the cell wall. That's tomatoes for you. But taking it raw, you may not get the best of lycopene, okay? And lycopene is in every red fruit. In fact, it's called a carotenoid. That's what gives, is any substance that gives color to fruits. Lycopene is what gives fruits their red color. So any fruit you see that is red in color, red peppers, watermelon, anything that has red color, you know it has a lot of lycopene. But out of all of them, hey, tomatoes is your best bet. Okay, what else is there? Omegas, yes. Fish that are rich in omega-3 fatty acids. Omegas are anti-inflammatory, so they help to reduce swelling. And you know, prostate enlargement is a swelling. So you need a lot of omegas. And you get that from a lot of foods, especially salmon. You get it from sardines. You get it from tuna. And this local fish, this dried fish, you know, they sell it in the market, is very good. Then take a lot of fish oil supplements that are rich in omega-3. All right, then foods to avoid. High cholesterol foods. Please avoid them. Red meats, avoid all of them. Somebody said, we dig our graves. Well, not me and you. They dig their graves with their forks and knives. Please, eat to live. Don't eat to die. Avoid the bad fat. Eat the good fats. Okay? What else is there? Yeah, these are the foods you need to avoid. All this horrible food, mayonnaise, shawarma, pizza, all of these crazy foods. Please avoid them as you grow old. Remember, borrow some sense. As you are growing old, you need to watch what you eat. Avoid bad cholesterol. It's in all these pastries, saturated fats, then because of types of fat, trans fats, all these processed fats. Then your body even releases cholesterol. So your liver produces 80% of the cholesterol you need. You don't need more from all of this junk food, especially red meats. Avoid red meats. Then, of course, bad lifestyle, cigarette smoking, alcohol drinking, fast food, gluttonous living, then sedentary lifestyle. Try to do some exercises. Walk instead of sending people. I walk up to about 10 kilometers. Instead of me taking a car or taking a cab, I walk to an ATM very far from my house. I deliberately take a walk because I don't get a chance to do much exercises because of this COVID. So I make sure I exercise myself with walks. Don't do strenuous exercises, just take walks. That will really help you. Okay? So avoid all of these alcoholic drinks. You don't need it at all. Then embrace a culture of nutritional supplementation. What are supplements? This image says it all. Supplements are not drugs, in quotes. They are not medication. They are not pharmaceutical preparations. They are food repackaged in tablet form so that you will get all the nutrients you need that you couldn't get from the foods you eat. That's all. That's what a supplement is. Well, let me give you 4 good reasons why you should supplement. You see that image? As you take a supplement, your body takes in all of the nutrients that are in fruits and vegetables. Okay? Let me give you 4 reasons why you should supplement. The first reason is that, hey, the soil doesn't have nutrients. Farming practices have also removed nutrients from the soil. So where would you get nutrients? Somebody was telling me, see, Boye, I don't need to take supplements. I take a lot of natural foods. I said, sir, the soil that the fruits are grown on don't have nutrients. So where will the fruits that are grown on those nutrient deficient soil get nutrients from? He was just looking at me. You know, there are some soils in some parts of the world that are totally deficient in some nutrients, naturally deficient in some nutrients. Then bad cooking and modern cooking practices also erode nutrients from foods. Then self-poisoning or food poisoning or environmental pollution also kills the nutritional value that you have gotten from foods. Okay, so all of this makes it necessary for you to supplement, to put in your body what you should have gotten from foods, but because you don't eat them, or you don't eat them in the right amount, or the foods you eat don't contain them at all, or contain too little of them, that's why you need them in supplements. Now, supplements are manufactured by different companies. I'm not here to demarket any particular company, but out of all the companies that produce supplements, one stands out in the area of supplementation for prostate health. Because I know the nutrients that the prostate needs. I've been at it for the past 21 years. I know what the prostate needs as nutrients. But now to get a company that will give me the full package, I'm like a football manager. I can't go and buy jersey from Puma. And because Puma doesn't make shorts, I have to go to Nike to go and buy shorts. Or I need to go to Adidas to go and buy boots because Nike and Puma don't make boots. So I kit my footballers with kits from different manufacturers that don't have everything. Why don't you get a manufacturer that will give you a jersey, shorts, boots, socks, everything? Everything you need for prostate and sexual health. Well, we've looked around and have found a company that manufactures an excellent range. And because this is our own approach to prostate health. The first one is to stop that enzymic activity that metabolizes that unfriendly DHT, that converts testosterone to that unfriendly DHT, beg your pardon. Stop that enzymic activity so that less DHT is formed. Now, when less DHT is formed, now we now help to boost testosterone production so that more testosterone is produced inside your testes. It's by a combination of nutrients. Testosterone is produced, the factory of testosterone is your testes. So we put in the nutrients there that will catalyze fresh production of testosterone. Meanwhile, stop the conversion into DHT. So more testosterone is built up and less DHT is formed. Then correct combination and synergy of other nutrients that will nourish the prostate, okay? And antioxidant protection, especially if you have reached about 50 years old. Then for sexual health, our approach is in three main dimensions. First of all, we boost the production or reproduction of testosterone. We've said that earlier. Then we introduce what is known as aphrodisiacs. Now, what are aphrodisiacs? Aphrodisiacs are substances that stimulate sexual desires. Now, aphrodisiacs are of two main sources, synthetic and natural. The synthetic ones are the ones manufactured by pharmaceutical companies. They're the ones that are manufactured by so many companies that induce sexual behavior. Some even cause priapism. You know what priapism is? Penis erection that was not due to sexual stimulation, where your penis will stand as rock and will not go down. Priapism. I'm sure you have read so many stories online that so many men that have taken the blue pill, okay, I won't mention brand names, that have died on top of women. Why? Because it causes unusual exercising of their heart rates and they die in the process. We don't recommend people to use synthetic aphrodisiacs. The aphrodisiacs we recommend are from natural sources that have science backing. Natural sources from plants and herbs that stimulate sexual desire and appetite and promote sexual health for men and for women. But in this case, we're talking about women. Then we all know that the penis doesn't have bone. It's a set of muscles and connected with tubes, arteries to take blood there and veins to take blood out. Okay, so what makes a man have good erection is the flow of blood into the penis, good flow. So we help you with nutrients that will promote blood flows, promote circulation of blood, and give you strong, turgid erections. Okay, so that's our approach for sexual health and for prostate health. And a company that we have found out that can produce all we need for this is the company that we recommend the best of their products. And coincidentally, they have offices all over the world. So if you're connecting us from any country in the world, you can actually pick it up locally in your country. Our partner that invited you for this event will connect you wherever you are in the world, and you will be able to get these products. The first is called the Vitalize for Men. It's the main vitality supplement that is formulated just for prostate health. Everything you need, ladies and gentlemen, for a healthy prostate is inside these supplements. Don't take my word for it. Do a screenshot and go and do a Google search and find out what pygium extract does for the prostate. Find out what pumpkin seeds do. Find out about saw palmetto. Find out what vitamin C, D, and E will do for your prostate health. All of these and more combined in these fantastic supplements that all men should be using on a daily basis. We have some others that our partners will tell you more about. Let me just run through it. We have the very, very good omega-3 supplement, the Arctic Sea omega-3. If you ask our partner who invited you here today, they'll give you a video demonstration that I did on this particular Arctic Sea omega-3. Just contact our partners, tell him or her that I mentioned a video that I did on this, that person should send you that video. They'll gladly send it to you. It's a very powerful video. Then we have the bee propolis, a powerful all-natural antibiotic supplement. The bee pollen, go and Google it. Just type on Google, pollen and prostate health. You see, information is free online. Just type it, bee pollen and prostate health. You read it up yourself. Then we have the vitamin A and vitamin E supplement. Very powerful combination. Vitamin A in its natural state of beta-carotene for best absorption of vitamin A in the body, combined with vitamin E, will give your body very, very strong antioxidant protection. Okay? Then we have drinks. Very, very, very good drinks. We have the berry nectar that helps to clean out the bladder. Cranberry juice is excellent for prostate, for bladder cleansing. Don't take my word for it again. Go and Google it yourself. Just type cranberry juice and bladder. Read it yourself. Cranberry juice. This is not cranberry flavor. This is the raw extract from cranberry juice. The juice itself. Then it also has apple juice, and apple juice is rich in pectin. So this also helps to clean out your urinary system. Very, very good. Then we have this drink. Oh, this is the most powerful antioxidant drink. I don't miss it daily. It's called pomestine. It's a combination of the juices from two fruits. The first is called mangosteen, and the other is called pomegranate. Mangosteen, pomegranate are the two fruits with the highest antioxidant protection. They have a ranking, they call it ORAC ranking of the fruits with the highest antioxidant protection. Mangosteen and pomegranate are high up there. They're in the first 3, or is it first 5 of the most powerful fruits in terms of antioxidant protection. Remember, I told you about the need for antioxidant protection when it comes to free radical damage. Remember, unpaired electrons that destroy the body at the cellular level, and antioxidants help to donate their own electrons so as to settle the quarrel, as we say in Nigeria. Settle the quarrel. The problem is electron shortage. Take my own electron. Let there be peace. Okay? This is a very powerful concentrated drink. You can't even drink it raw. You have to dilute it with water. Just dilute it to taste. Powerful drink to take every day. And of course, the best-selling aloe vera juice, very rich, full of nutrients, and so many other things, called the aloe vera gel. This is also very good for your prostate. Okay, yeah, that's the Arctic Sea. I can't stop talking about that supplement. It's a powerful supplement. Well, if you can't get it up, you know what I mean? You can't get it up, then you need some boost in your you-know-where. So, rise to the occasion with the multi-maca. Now, what does maca mean? Maca is produced mainly in a country called Peru. Maca. That's the thing. It's a root. It's actually grown like yam, under the soil. Maca. It's grown mostly in the country of Peru. That's why it's popularly called Peruvian maca. Go and Google maca. Maca is known by science to be a very powerful natural aphrodisiac. Maca promotes sexual health like nothing else. It will maca your body, if you know what I'm talking about. Then we have ginseng. Ginseng is a well-known aphrodisiac. It also boosts stamina and endurance level. Okay, so we have supplement made from maca. You see the supplement there? That's it there. It's called multi-maca. That is, it has more than maca. And the one from ginger combined with chia seeds. Ginseng, beg your pardon. Ginseng then combined with chia seeds. Chia is also another powerful antioxidant. Aphrodisiac. So ginseng combined with chia and used with maca. Oh my God. Will set your bedroom ablaze, if you know what I'm talking about. Okay, what else do we have there? Supplement for sexual health. Okay, supplementary products. Now these ones will help to promote blood circulation because it helps to dilate blood vessels. The ginkgo biloba plant is well known to dilate blood vessels, and when blood vessels get dilated, they carry more blood, more nutrients, and of course, stronger, longer lasting erections. We have this Ag Plus containing L-arginine, which is a very important amino acid that gets depleted as we age. In fact, when we're old, we don't have any more L-arginine in our system. That's why we have to supplement L-arginine with this beautiful product. See, a Nobel Prize winner endorsed this product as the best supplementation in the world market for L-arginine. Don't take my word for it. Type it on Google. Write it down as I'm talking. Just type FLP product and Nobel Prize winner. Don't even mention the name of the product. Just type FLP, that stands for Forever Living Products. FLP product and Nobel Prize winner. Prize is Prize. Nobel is Nobel. FLP product, and you will read it yourself on Google. You see, I'm not supporting this product for this brand for any other thing, but for the fact it keeps my integrity intact. I will hate recommending something to people and they come back with curses. I've been at this for 21 years, since 31st of July, year 2000. To the glory of God, I'll be 21 years of recommending this brand as the best product for health and wellness. Go and check it out. This man went on YouTube and put his Nobel honors on the line to recommend this product. Okay, and of course the bee pollen, I told you, is excellent for your bladder, especially when your bladder has been stretched, if you know what I mean. To improve activity in the bedroom for fertility, we have a range of very good products that will help with a man's sexual health, help to promote sperm production, help to promote semen production, and help with erections generally. Okay, so men, let's talk. If any of what I've shared with you tonight resonates with you, then, or if you're a spouse of a man and what I'm saying here is something that you know is happening to your husband. You know, I remember one seminar I did, I was talking about frequent urination at night, and this woman walked up to me after and told me, you know what? Every night I see my husband wake up in the middle of the night and he'll go to the toilet. I thought he was going to chat with his girlfriends. So this particular night, I was waiting for him. He thought I was sleeping. As usual, he got up to go to the toilet. I tiptoed. I waited for him to start his chat. I was tiptoeing to go and catch him red-handed until my eye saw his phone on the table. She had nocturia for the first time. He said, my husband wakes up 5, 6, 7 times before daybreak. Come and help me. She didn't know the man was having a problem. The man didn't even know he was having a problem. So if you're a woman here and some of what I've shared with you resonates with you, maybe you stop complaining that your husband is always soiling the toilets. Maybe you stop complaining that he's not responding to sexual stimuli. Maybe with what you've heard tonight, you will stop lamenting and think of helping him out. Or maybe it's your brother or even your father. Talk to my partners wherever you are in the world. You can get these products locally in your country. I have more than about 20 of my partners on this platform with me, and all of us have invited you guys here tonight. Now, you may know the person who invited you, like I said earlier, or you may not know that person. You may have just seen it on a WhatsApp group, but there's a phone number on that contact. Please make sure you contact that person and tell the person, thank you for inviting me for this talk. I want to take it up from there. If and when you need to talk to me directly, they will link you up with me. I'm not displaying my phone number, okay? My phone number is only available to those people that I personally invited. My name is Boye Abe. Sorry, I forgot to introduce myself at the beginning, but I'm sure you saw it on the screen. Boyeabe. If I invited you, you will see my phone number on my invites. So get in touch with me. If you're invited by my partners, get in touch with them. If and when you need to talk to me, they will decide that. Talk to them and they will connect you with me if there's need. But they're all very competent partners I have, and I'm sure they'll be able to take care of your need wherever you are in the world. I have the deaf community joining us for the first time. We want to thank you so much. Thank you, Mr. Toby, for your sign language to interpret it for them. We'll be having a lot more of them as we go on in our presentations. For those of you that have joined us from foreign countries, from Kenya, from UK, from US, we have guests from Ghana, we have from some South Africa. We appreciate you. Yes, we have one or two people from Dubai. I saw my friend in Dubai. Thank you. Hi, Dubai. Please take care because of COVID. Just be safe, okay? Let's do more of online presentations so that we can stay protected. Well, my parting shot for you is this slide here. Protect your vital equipment or his vital equipment, as the case may be. Two approaches. We have preventive and we have restorative prostate health care. I want to stop the presentation at this time to be able to take your questions. I have muted you all from the start for obvious reasons, but like I promised at the beginning, I will unmute you so that you can ask your questions. I want to thank you so much for watching, for reading, and for listening to our prostate health educational talk. We'll be having another one in 2 weeks' time. By the special grace of God, in a fortnight from now, we'll be having another one. We want to encourage as many of you as are listening to me to partner with us and join us to help more people all over the world to good health and to money making. Why not? We are prosper in health. Remember, we help you to prosper in your health, and we help you to prosper while maintaining good health. A lot of people prosper, but at the detriment of their health. But we help you make money and also maintain good health. Our associates will tell you more details about how you can partner with us, not just for the next event, but on a permanent basis. So I want to thank you so much. This is the time for you to ask your questions. Like I put up there, questions are the answers. And like somebody said, there is no foolish question. You know why? Because foolish people don't ask questions. Okay? So don't think any question you ask is a foolish question. Nothing called foolish question. If you're a foolish person, you can't ask questions. So once you have a question to ask, it means you're a wise person. In fact, the more questions you ask, the more it shows that you have processed this presentation very well. So, like I promised, please raise your hand. In case you're not too conversant with Zoom, if you look at the bottom strip, you will see how to raise your hand. Okay, just press that button and I will see it on my screen here, and I will be able to unmute you because I need to unmute you so that you